You may have heard about hepatitis C before, but what is it exactly? Here are the answers to 5 common questions many people have about the hepatitis C virus. What are the main differences between hepatitis C and hepatitis A and B? Hepatitis C is an infection in the liver caused by the hepatitis C virus. Hepatitis A and hepatitis B also affect the liver and are sometimes confused with hepatitis C. However, the 3 viruses and the infections they cause are not the same. Hepatitis A is typically passed through contaminated food or water. There is no treatment for hepatitis A, and the infection usually clears on its own. Hepatitis B is typically passed through blood, semen, or vaginal fluids. Most adults will clear the virus on their own and develop immunity. Some will have the virus for the rest of their lives and will need to be monitored. Hepatitis C is typically passed through blood-to-blood contact, even if the amount of blood is so small that you can't see it. About 1 in 4 people will clear hepatitis C on their own, and the other 3 in 4 people will need treatment to cure the infection. Another key difference is that there are vaccines to protect against hepatitis A and B, but there is no vaccine to protect against hepatitis C. What are the symptoms of hepatitis C? A person can have hepatitis C and not feel sick or have any symptoms for many years. This is because the virus injures the liver slowly over a long period of time. After many years of living with hepatitis C, a person can become very sick, and it can become difficult for the liver to function. At this point, there could be a buildup of fluid in the abdomen, serious abdominal infections, internal bleeding, or severe liver damage, all of which are high-risk complications. If left untreated, the liver becomes more seriously injured, which may lead to liver cancer or even death. Getting diagnosed and cured of hepatitis C sooner helps to prevent further liver injury from the hepatitis C virus. The only way to know if a person has hepatitis C is to get tested. Is injecting drugs the only way a person can get hepatitis C? Reusing and sharing equipment for injecting drugs is the most common cause of the new hepatitis C infections in Canada. Sharing equipment used for smoking or snorting drugs can also pass hepatitis C. Using new equipment every time a person uses drugs prevents hepatitis C. Hepatitis C is a small but strong virus. It can survive in a tiny drop of blood that is too small to see and can live outside the body for many days. In certain conditions, such as inside a syringe, the virus can survive for many weeks. There are other ways that hepatitis C is passed blood to blood. For example, through getting a tattoo or piercing with equipment that was not sterilized properly, reusing medical, dental, or surgical equipment that was not sterilized properly. This is very rare in Canada today. Receiving a blood transfusion or organ transplant that was not screened for hepatitis C. In Canada, donated blood has been screened for hepatitis C since 1990. Sharing personal care items that may have traces of blood on it. There is no risk of getting hepatitis C through casual contacts like hugging and kissing. Anyone who thinks they may have been exposed to hepatitis C should get tested. Can hepatitis C be cured? Treatment used to be difficult and had low success rates, but it is much different now. Today, treatment is highly effective at curing hepatitis C. Treatment consists of all oral pills that are generally taken for 8 or 12 weeks. Side effects are typically mild and diminish or go away after a few weeks. The most common side effects are headache, nausea, and feeling tired. Many people go through treatment with no side effects at all. Treatment is widely accessible in Canada, and most people don't have to pay out of pocket. All people with hepatitis C should speak with their healthcare provider about their treatment options, including people who use drugs. People who use drugs should be offered hepatitis C treatment, regardless of whether they plan to continue, reduce, or stop their use of substances. After being cured of hepatitis C, some people report feeling much better, including having more energy and less body pain. For some people, liver health improves over time too. Is it possible to be immune to hepatitis C? No one is able to develop immunity to hepatitis C. A person can get hepatitis C again if they are exposed to the virus, even after they are cured or cleared the virus on their own. This is called reinfection. People who may have been exposed to hepatitis C should always get tested and be offered treatment if needed to cure their infection. To learn more about hepatitis C, visit kd.ca, talk to a healthcare provider, or visit a local hepatitis C organization.